Thank you so much. We're moving right along in our 5-minute presentations. Next, we have Dr. Stewart from the Burnett Institute.
All right. Thanks so much for the introduction. Before I get started today, I would just like to firstly thank the participants who have given their time and information to the study. Of course, without them, none of the work that we do would go ahead. Thank the Burnett Fieldwork team for their tireless efforts in study recruitment and follow-up, and I have no disclosures to declare. I have the absolute privilege of living and working on the lands of the Boonwurrung people and the Wurundjeri people of the Kulin Nations, and I pay my respects to elders past and present, always were and always will be Aboriginal lands. So people who inject drugs, we know, use emergency healthcare services at a higher rate than the general population, and stigma and discrimination are well-known barriers to accessing mainstream healthcare services, and this can lead to delays in treatment, poorer health, and increased reliance on emergency services. Previously, studies that have looked at ambulance use and attendances among people who inject drugs have really focused on the context of overdose and drug-related harms, and very few of these studies are sex stratified. So when we think about women who inject drugs, we know that they face distinct risks. They have poorer mental health, interpersonal violence, high-risk sexual and injecting practices, and often are involved in caregiving roles more than men. And we know that all of these things can affect their healthcare access and the way that they might use ambulance services. So for this study, we used self-report data and linked ambulance data from the Supermix cohort, which is a community-recruited cohort of people who inject drugs in Melbourne. It was established in 2008 and it's still ongoing. We aim to estimate the annual ambulance attendance incidence rate and rate differences between men and women, and we wanted to measure whether or not the rate of change in ambulance attendances over time differed by gender. So 33% of our sample was women and 80% of our sample had at least one ambulance attendance during the study. Not presented on the slide, but just some descriptives. So women in our study were typically younger, were post-school educated caregivers, more likely had a history of child removal and greater access to healthcare services than men. We found just over 9,000 ambulance attendances in this group, over 13,900 person years of follow-up. And in general, women had a higher incidence rate than men over the study. So between 2008 and 2014, rates were stable, but they were almost consistently higher for women during that period. And between 2014 and 19, incidence rates for both men and women increased, with a greater rise for women. By 2019, the rate for women exceeded that of men by almost a rate of 47 per 100 person years. And I haven't showed, given it's a rapid fire, I haven't showed these results on the slide, but when we modelled change over time, it showed that there was a similar upward trend in ambulance attendances across gender between men and women. So the key findings of this study: women in our study were younger and had distinct social and healthcare characteristics, including more commonly reporting caregiver roles and a higher engagement in healthcare services. Compared to men, women had a higher rate of ambulance attendances over the study, but ambulance attendance rate changed in a similar way for both men and women. And so the next steps for this study, we're going to use the major diagnostic categories to try and analyse the actual differences in the reasons why people might be using ambulance services. And we're hoping to get an updated data linkage to 2024, and that will hopefully then allow us to see if that difference that we observed in 2019 actually did persist, and also to explore whether or not there were changes during COVID. And just to end, I think it was a quote that was actually said by someone in THU 2 years ago, I think it might have been, that was that women who inject drugs are not just the female version of men who inject drugs. And I think that was really highlighted in the presentations before and all the presentations that have been provided in this session. So it's so great to see so much work among women. Thanks.